We've shown you there, keep getting updated, hence that plus sign. And once again, our source is the World Health Organization, that is WHO. Now, let's take you to our Dr. Mercy Korir. Good afternoon, Doc. Great to see you. Let's just talk about those numbers. First of all, globally, you know, the US, China, Spain, Italy, even before we get to Africa, Doc.
I think we're seeing the pandemic rising, and this West African, the countries in the global north are getting affected more and more by the day. And so we expect to see that the numbers will go up, but hopefully also the number of recoveries or the number of people who've recovered will also go up, and the number of deaths will go down. And as you can see, Italy sort of has been able to kind of stabilize their numbers, not so many deaths being reported from Italy, but then the other European countries are reporting a great number of deaths. So it's still a going concern. It is still an issue that will keep on developing, even as countries try and contain the pandemic in their own countries, and more so the effect that it has on the healthcare system, which no doubt we've seen the number of cases, the number of deaths, and the number of critically ill patients that need care, need critical care, and this is what has had weight on the healthcare systems. Now, looking at these numbers, it is good to give percentages so that we see exactly where we are. And in all of these global numbers, it's good to note that the number of people with mild to moderate symptoms, or the conditions, people in mild and moderate condition, is about 70% of all the numbers. Those that have been critically ill is about 4% of the numbers that have been reported. Deaths have been about 4.5% of the number of deaths, depending on which day it is. And those that have recovered is just slightly over 20% of the number of cases. So if we look at it, the concentration actually is on the number of people who are critically ill, so that they don't progress to lose their lives or to succumb to COVID-19 related complications, because the expectation is that the bulk of the people, the 70% or so, who have mild to moderate symptoms can progress and can recover, and would actually up the numbers of the recovered people, who are just about 20%, Grace.
Indeed, Doc. Let's now come here to Africa and look at some numbers. I believe you have them, Doc. If we could compare actually Rwanda, Kenya, Tanzania, and Uganda, especially here in Kenya, because yesterday we, for the first time, saw a huge number of positive COVID-19 cases, 22 to be precise, bringing our numbers to 81. Again, Doc, I know I have used this statement time and again. Tedros Adhanom told us to prepare for the worst. Are his words coming to pass, Doc?
For me, how I look at the numbers, or even when there is a drastic increase of the numbers, it is a good thing, because it means we are testing, we are able to identify the number of people and who it is exactly that is affected by COVID-19. So when we report a high number of cases, be it 22, be it 10, even if it's 50, it is a good thing, because it means we are identifying the people who have contracted, who have been confirmed to have COVID-19. And when we identify, as we said yesterday, it is a story. The story is, how did this particular person contract this illness? Now, giving the Kenyan example, the CS for Health yesterday, Mutahi Kagwe, when he was giving this report, he said that out of the 22 people who are positive, 21 were as a result of the mandatory testing that was done on the people who are on quarantine. That is a good thing, because it means then these were all people who imported the virus. They were in quarantine, and we were able to capture them before they were out in the community, and before the spread in the community became further and out of control. So it is a good thing. What I would be worried about is when we have many local transmission, or if we are missing cases due to local transmission. This means somebody like you and I, who are going about our business in the community, the curfew notwithstanding, we interact with a lot of people. And if I have COVID-19, the coronavirus, and I interact with somebody else, then it means we are not able to really trace and track everyone who has come in contact, and so that is where we might lose control of the COVID-19. So yes, the words of Dr. Tedros of Africa to prepare for the worst could be coming true, but if African countries, if the countries do testing as much as possible, if they trace and track everyone that has come in contact with everyone who's been tested positive, then we may be able to contain we might be able to contain the spread of the virus so that we do not see local transmission. And when local transmission spreads, then we'll see the vulnerable or the people with pre-existing conditions then in need of critical care, which is now where the problem is, because as African countries, most of our health systems cannot cope, cannot handle that demand of critical care patients coming in at the same time. Grace.
Doc, before I let you go, please, another a minute, let's talk about the recoveries, because as far as I'm concerned, and correct me if I'm wrong, in the 4 countries that I mentioned, Kenya, Tanzania, Rwanda, Uganda, I see a recovery in Tanzania, and of course ours in Kenya, 2 recoveries. Why are we having this, let me put it, not so many recoveries in Africa, Doc?
Okay, for one to have been certified or confirmed to have recovered, they need to have 2 tests, 2 negative tests within a span of 24 hours. At least that's the protocol that Kenya is using. That if you had been confirmed, once your symptoms start reducing, then they do 2 consecutive tests within 24 hours to confirm whether you have the virus or not. Once you test negative in those 2 tests, then you are confirmed as recovered. This, I must say, is even as that happens, we have that the people like in Kenya who are under treatment or under isolation have actually been in stable condition. They're just waiting that confirmatory test. Only about 1 person was in critical condition according to the government as at yesterday, and we hope not to get many people in critical condition. So the recovery is because they also have to confirm that they are negative the same way they confirmed that somebody is positive. So the numbers may be slow in coming up, but hopefully we will quicken our steps so that we can have a true picture of the number of people that have recovered, not just in Kenya, but also the East African community and Africa as a whole, so that we have a true picture of the state of coronavirus pandemic in the continent.
Certainly, Doc, and of course we do hope for better and brighter days. Thank you, Doc. Dr. Mercy Korir there, our medical correspondent here on KTN News. She was joining us from our CT Center studios, and of course we're talking about the numbers of the COVID-19 pandemic in Africa and of course globally. Let's